Welcome to our Chamberlain Master of Science Nursing degree program for our Family Nurse Practitioner Specialty track. This module is an introduction to student requirements for this program. Hello, and congratulations on your decision to enter the Chamberlain MSN Family Nurse Practitioner program. We are glad to have you here. Our goal is to assist you, make an impact on your education, and help you be successful in the program. But I'm guessing you're asking yourself, so what do I need to know about the FNP specialty track? The FNP specialty track has 4 parts to it: curriculum, the immersion weekend, your clinical practicums, and your clinical compliance requirements. Let's look at curriculum courses first. You need to complete core courses, track specialty courses, and practicum courses. And it's pretty easy to remember too. It's 5 of each: 5 core, 5 track, and 5 practicum. Your core courses consist of the classes listed here. Course descriptions and details can be found on the chamberlain.edu website and in your student portal. Next are your 5-track specialty courses. NR 510 is taken in place of NR 504 during your core classes, but it's considered a track course. And the last segment of your curriculum are the 5 practicum courses listed here. Again, refer to your resources for descriptions for any courses in the program. One of your requirements is the immersion weekend. But what exactly is an immersion weekend? The immersion weekend is a 2-day weekend event held in a suburb of Chicago. It occurs near the end of the session for course NR 509. It is the 10th class in the overall program and the course that precedes your practicums. So what happens at the immersion weekend? During the immersion weekend, you will be given personal attention from our experienced faculty and gain hands-on experience. You will have the opportunity to observe, participate, and be evaluated on clinical assessment skills. The goal is for you to be clinically competent and ready to start your practicum courses. Students are responsible for their travel costs while participating in the immersion weekend. Typical costs include travel to and from Illinois, lodging, and meals for 1 to 2 nights. As you get closer to this course, your student support advisor will provide information related to dates, location, and can answer any additional questions you may have. Now let's take a look at your clinical practicum requirements. First are the actual courses, which have required hours and schedule commitments. These courses have a family practice focus, and there is an application process you need to complete. In some instances, there may be additional compliance requirements due also. All the courses listed here require you to gain experience completing practicum hours in a clinical setting. These courses require 125 practicum hours per each 8-week session. This equates to approximately 16 to 18 hours per week. That's quite a workload for those of you who are already working nurses. Practicum hours may vary each week due to schedules for both the student and the preceptor. Practicum hours are in addition to your regular classroom expectations. As you can see, this will require some planning on your part in order to meet all your requirements. The goal here is to get you thinking ahead. Chamberlain is committed to providing the best opportunity to complete the FNP program and help you pass the National Board Certification exam. With this program, a well-rounded clinical experience is key to success. We emphasize a strong family practice focus throughout the practicum experience. A true family practice site offers wellness exams and sick visits to all ages, birth through geriatrics. Ideally, you will choose this type of setting for all your practicum courses. Other options are available for some of your practicum experiences. For NR 511 and NR 601, you have 3 options. First is adult primary care. This option requires a pediatric rotation to be completed in later courses. Next is family practice. If a broad range of pediatric exposure is noted in practicum logs, you may use the site for all courses. And third is pediatric primary care, which is limited to 1 session. You will need to pursue internal medicine or family practice for NR 601 and NR 602. The remaining practicum courses should ideally be at a family practice location. However, once the primary care and pediatric exposure has been satisfied, you may branch out to a limited set of specialty settings for NR 603 and NR 661. The following settings will be approved for 1 session. women's health, urgent care that is not hospital-based, retail clinic, college health clinic, incarceration primary care, and primary care mobile unit. Let's shift our focus now to the actual clinical practicum process. First, you are responsible for identifying and securing an appropriate practicum site for each practicum course. You may use the same site for all, provided it meets the requirements. Some of the individuals who are involved in the process include your practicum coordinator, who assists with guidelines, applications, and can answer questions, your preceptor, who will orient you to the practicum site environment, their policies and procedures, and will identify suitable learning opportunities that align with the course outcomes. The clinical compliance team can assist with any clinical compliance needs, and your faculty who approves your practicum site. Part of the process includes completing documentation. One document is the practicum site application. This needs to be completed and submitted for each practicum site. The contractual affiliation agreement is something the practicum coordinator uses to secure an agreement with your site before you can begin completing your hours. Next is the clinical compliance checklist. You may need to fulfill additional compliance requirements in order to complete hours at various sites. Refer to your FNP Practicum Handbook, which provides guidelines and information about selecting the site. An important part of your program are the compliance requirements. FNP students must clear a background check and fingerprint screening before registering for any FNP specialty track course. This is to comply with a Department of Education regulation related to pre-enrollment background checks for programs that lead to licensure. All students need to complete both items regardless of where they are located. Complio is a compliance screening and immunization tracking system used by Chamberlain. Students will receive an email with a link to Complio instructing them to authenticate their account. Students will then need to select the appropriate packages to fulfill their requirements. Fees will vary by state. It is important to take action early. Obtaining results may take up to 8 weeks, which may hinder the student's progression through the program. Fingerprint results are sent directly to the student once available. Students must upload their results into their Complio account. Students have 30 days to retrieve results once they have been sent and 24 hours to save them once they have been opened. There are exceptions for students in Ohio, Florida, and Pennsylvania, where results are sent directly to Chamberlain or American Databank. Contact the Chamberlain Healthcare Compliance Department for further assistance. Let's take a moment to review. The MSN Family Nurse Practitioner program has 4 parts: curriculum, the immersion weekend, your clinical practicums, and compliance requirements. The curriculum includes core, track, and practicum courses. Your 5 practicum courses will require a focus on family practice. You are responsible for securing a practicum site for each course. These courses require 125 clinical practicum hours per each 8-week session, in addition to your regular classroom hours. You might be thinking, when does all this occur? During course NR 503, you will receive specific details on your practicum site application process. During course 509 is the immersion weekend. Approximately 6 months prior to the start of your first practicum course, you will need to begin looking for a practicum site. As always, if you need further information, please review your resources such as your FNP Practicum Handbook, the Clinical Compliance Checklist, your student portal, and chamberlain.edu website. Contact your practicum coordinator with specific practicum questions.